Hey, this is Kathy Cladar, nurse practitioner, with a quick video for you about decongestants. If you're congested or have sinus or ear pressure or allergy symptoms, or if you've caught a horrible cold, or even if you have COVID, the most effective decongestant strategy is the same, no matter what. The simple over-the-counter medicines actually work the best. All data supports that they're safe, they're easy to find, you don't need a prescription for any of them, and to buy the whole set it costs you less than 20 bucks. So here's the rundown on them. The first medication that you absolutely need to have on hand if you're congested is oxymetazoline. That's the active decongestant in all decongestant nasal sprays in the United States. They're usually called 12-hour decongestant sprays like Afrin or Vicks Sinex. They come in various formulas with moisturizer or added ingredients like menthol or not. My favorite versions are the ones at the dollar stores, where you can literally get them for $1, and they often come in both menthol and non-menthol, so they're nice and simple without a lot of additives, and they work great for just $1. Use those at least 2 sprays, or fully saturate both nostrils every 12 hours until your congestion is gone. On the label, it'll say you can use it for up to 3 days. You can use it as long as you want. It's not going to hurt you. You may lose your sensitivity to it and it'll stop working. When that happens, stop using it for a few days, try it again, and it usually will have all of its oomph right back. It'll start working again. A lot of people use them once a day on an ongoing basis, like maybe at night before going to bed, especially if they wear a CPAP and need help with congestion that they have all the time. I have dust allergies, so I have them all year round, no matter where I am. And it's extremely helpful, and it has been for more than 40 years. The next medication that you can buy over the counter is triamcinolone nasal spray. The brand name for that is Nasacort, that one that used to be by prescription only and was extremely expensive, but now it's not. And Walmart has their Equate brand, Target has their generic, CVS has a generic that's more expensive than other generics. But triamcinolone nasal spray is the same drug that's in the shots called Kenalog, and in triamcinolone creams for severe allergies and things like poison oak. It's a prescribed medication in all of those other forms, but as a nasal spray, it's gentle and weak enough of a solution that it's safe to use every day, and it's recommended for use once a day. If you have had severe congestion or ear pressure for weeks, I recommend using it twice a day for 3 days, then back off to once a day. For some people, triamcinolone will be too strong and too drying to continue using it all the time. And at that point, you may want to switch to fluticasone, or generic for Flonase. It's a milder preparation, it's a weaker concentration, and for a lot of people, it's perfect to use year-round or all the time on an ongoing basis if triamcinolone is a bit too strong and too drying. If you're sick, if you've had a horrible cold, sinusitis, or COVID, or just horrible allergies, or you don't know what you've got, to get decongestion started in the beginning, twice a day for the first 3 days is often a good plan. Time your use of the triamcinolone so that you're always using it right when you go to bed, and saturate both nostrils, and then lay down so that you're not fighting gravity, so that that nasal spray stays up in those nostrils. The next medication that I want you to have on hand, unless there are any contraindications, is pseudoephedrine. That stuff that used to be in all of the cold pills, all of the over-the-counter medications, pseudoephedrine hydrochloride, until around the time Breaking Bad came out. And they decided to tell us that people make meth out of it, and it was placed behind the pharmacy counter. You can still buy it without a prescription in the entire United States, but you can only buy a 15-day supply for one person unless you have a prescription for more than that. Pseudoephed is extremely safe and effective, and it even comes in a children's syrup. For adults or kids over 11 years old or older, I recommend the 12-hour tablets. The reason is that you get lovely steady state decongestion. If you use the little 4-hour red tablets that look kind of like Red Hots, The problem with those is that you get a big blast of medication and powerful decongestion, but then it wears off quickly, and then you get rebound congestion while you're waiting for it to be time for the next dose. And they also make your mouth and throat very dry, and that can become quite irritated after all this congestion. So it's a lot more effective to use the 12-hour tablets. They're cheap. A 10-day supply of them, 20 pills, is typically what you get when you buy a box. And they usually run anywhere from $5 to $10, whether you're at Walmart, Target, or CVS. They are effective and safe for kids 11 and up. And the reason that kids get such a hefty dose is that kids burn it off faster. Their bodies are smaller, their kidneys are bigger in relation to the rest of their body, and it's eliminated from the bloodstream through the kidneys, and they just metabolize it faster. So they get a higher dose of that medication than we do. The children's syrup of it is very, very effective. Talk to your pediatrician. You don't want to piss them off. So if your child's primary care provider is terrified of Sudafed, you're probably going to need to have a discussion and come to some kind of agreement before you use it. It has been over the counter since the 70s at least, maybe the 60s. It's been around a long, long time. Tested, tried, and true over-the-counter medication. If you've got a child that ends up with ear infections after they get thick, goopy snot with a cold or other things that cause them to get a runny nose, this may be a solution for you. You may be able to nip those illnesses in the bud and get all that goop running out. If you've got kids who've got ear infections and they're in a lot of pain with pressure in their sinuses and in the middle ear, this may relieve that pain better than ibuprofen or Tylenol, acetaminophen that you might be using, or the two together may be the best choice, especially if they've got fever. If you don't allow that goop to run out of the middle ear and get all the pressure out of the sinuses and remove the reservoir of bacteria-laden junk, bacterial infections won't go away. And viral infections are a little bit different. They're all over your body and they're in your tissues a bit differently than bacterial infections that are a bit localized. So it's harder to get rid of them just by removing the goop. However, you got to get that goop out of there to get well, no matter what the cause is. So Sudafed is safe unless you have high blood pressure, hypertension, which is affected by it. Not everyone with hypertension will have any blood pressure change if they take Sudafed. A few people will. Some high blood pressure medications, not all, and not in all people, will be counteracted by the pseudoephedrine. So there's another issue. If you happen to have a medication that is known to have an interaction with Sudafed, if it counteracts your high blood pressure medication, it would raise your blood pressure like you had missed a dose for the day, potentially. It's a good idea, best idea, to talk to your pharmacist. If you have hypertension and you think that you want to take over-the-counter Sudafed, do so with the advice of your pharmacist telling you if they think you have any medication interactions for that oral medication, pseudoephedrine 12-hour tablets, or for a child on any prescription medications, the pseudoephedrine syrup. Ask them if they think that it's safe and okay to use exactly as the label instructions are. See what they tell you. If they feel there are any contraindications, then you absolutely have to go talk to a doctor about it before you do it. If you have a doctor and you're under somebody's care and if things go wrong, you've got somebody you can reach out to for sure. Get their advice and their blessing to try one dose and see what happens. And if you've got hypertension, I really hope that you've got a blood pressure cuff at home and that you're checking your blood pressure regularly at random times just to see what it is. You cannot feel high blood pressure. There is no sensation of high blood pressure. And there's no way to know if what you're doing for your high blood pressure is working or if your blood pressure is getting worse without checking on it. So it's really important if you're going to take a medication that potentially might raise your blood pressure when you have high blood pressure, you got to have a working blood pressure cuff and you got to have some readings on hand to know how it's been so you can know if it's different or not. If you take Sudafed 12-hour tablets and your high blood pressure doesn't go up, or in fact you're more comfortable and it comes down, then that's how you find out that you're a person with high blood pressure who can take that medication safely. However, talk to your doctor, see what they want to do, and make sure that they know what you're doing. Even if they tell you not to and you decide to do it anyway, tell them. So The next few things that I would like all of you to do if you're severely congested or just have ongoing congestion that's never all the way gone, drink a lot of fluids. Don't sit around making yourself drink water that you don't want when you don't feel thirsty, but have fluids available all the time and sip at them throughout the day. Keep track of what you drink throughout the day, and the goal is to drink 2 liters of fluids from all sources every day. That sounds like a lot, especially if you're trying to chug down 32-ounce glasses of water or something that's just disgusting to you. It doesn't need to be plain water. You know, a lot of us who drink milk, that counts. If you eat yogurt or other thick liquids, those count. All fluids count, so you don't have to chase yourself around with water that you don't want to drink. Electrolyte drinks are wonderful, but don't drink ones with sugar, and I recommend not drinking ones with aspartame. You also can make your own electrolyte drink at home. And I recommend also that you really increase your diet, in your diet, meats with meat fats. So protein has 4 calories per gram, fat has 9 calories per gram. Ideally, every day, everybody, every adult needs 100 grams of protein and 100 grams of fat for your body to be able to do its metabolic business, and that totals only 1,300 calories. And it's not a lot of food to get there if you're eating meat. You also need the B-complex vitamins, the vitamin C, the trace minerals, and all of the other nutrition that's only in meat. Humans are obligate carnivores. We are not made to eat plants at all. We can, and people sometimes successfully do, but if we don't eat meat, we're in malnutrition, and we have to make up for that with really fancy diet work, and it's very difficult. If you are congested and you've had chronic congestion, or you're ill, like a bout of COVID or a horrible flu or a terrible cold that just won't go away, you really need the nutrition of meat and those fats for your immune system to start to whoop ass and clear that problem. And it will help a lot. It's one of the reasons that broth, which is, you know, made out of meat, and it's got lots of salt, and it's got fat floating on the top, is the most fantastic thing that most of us want to sip on when we're sick. It really does work. And then the other thing is, I want you to have as much salt as tastes good to you. Your body will tell you how much salt that you need. I recommend that you use a Himalayan pink salt with no additives, or a natural sea salt like Redmond salt with no additives. Morton's does have a few unaltered forms of salt, sea salt and pink Himalayan salt, that aren't expensive. Walmart and other places have generics of them, and they are just as good if you read that label and there aren't things added to them to keep them from caking and stuff. You don't want to get starch in there that you don't need in your diet or in your body. And then the next suggestion that I highly recommend if you're battling chronic congestion or this happens to you a lot, stop eating grains, all of them. No grains, no rice, no wheat, no corn, no barley, no flour of any kind, no pasta, no bread. Get that crap out of your life. Gluten-free is not enough. If you have gluten problems and you've benefited from changing around your diet to gluten-free products, get off the grains altogether and your life will be completely different. If you're just congested and you're tackling a problem, give me 2 weeks with no grains and see what you think. And then go back to what you were doing and see how it turns out. Maybe you just need to get rid of them for a while, and it would really help clear a congestion problem. And all sugars. Sugar feeds bacteria. If you've got bacteria growing in your body, any sugar that you take in, any starch that you take in, which is just time-release sugar, whether it's potatoes or flour or pasta or cereal or oatmeal. Oatmeal is just a bowl of sugar. Get rid of all of that while you're trying to get the congestion to clear, and it will. And if it's not working, or if you want to come see me, if you're in Arizona and you're looking for a primary care provider, my office is in Parker, Arizona. I provide telehealth to patients anywhere in Arizona. I can provide house calls to patients anywhere in La Paz County, and my office is in Arizona in Parker. For office visits, my office visits are just $50. House calls right now are $100. And I'm available for appointments from 10 a.m. to 10 p.m. 7 days a week. I can come see you, or you can come see me when it works for you. And 15-minute phone consults are always free. So if you'd like to talk, or you want to talk to me about possibly enrolling in my direct primary care, if you need a new primary care doc and I seem like the kind of provider that you might like, give me a call. My number is 928-575-7552, and my website is primarycareforarizona.com. Thanks, guys.
See you next time.